This conference will now be recorded.
Hello students, I'm Dr. Divya from TeenEinstein. So here, now we are in the second part of chapter number 13, why do we fall ill? So this is a very important question in our life, like how we are falling ill or what situation makes us to feel like we are not healthy or we are in a situation like our body is not working well. So in this chapter, we are discussing about health and its failure, then disease and its causes, then infectious diseases. So about all these concepts we are discussing. So in part 1, we have discussed that health and its failure. What is the significance of health? That we have already discussed. See, this health and health issues, it's a commonly discussing word in everyday's life. So we can realize that like how we can be healthy, or we can discuss about that, like how we can say like we are healthy, or what condition is making us to stay in a healthy condition, or what is a poor health, and what and all this healthy attitude. What do you mean by that? See, we said personal and community issues both matters for this health, personal issues and community issues. Personal issues and community issues. So for that, we said like we need to keep our environment in a clean way. If our surroundings are clean, our environment is clean up to a limit, that can keep us in a healthy condition, right? Like for example, we have discussed about the garbage management. So if you're failing in such things, like failing in managing garbage and throwing it everywhere, and that makes several diseases and the flies or something, if you don't have, if you are not taking any measurements for preventing such disease spreading and all, that and all makes us to face a unhealthy situation, right? So we said social equality and harmony, these are necessary for individual health. Okay, so here in today's class, in the second part, we are going to discuss the distinctions between healthy and disease-free condition. Healthy condition and disease-free condition. Okay, healthy condition and disease-free condition. See, we said what is healthy condition, right? So health means, we said, that is the state of physical, mental and social well-being. Health means physical well-being, mental well-being and social well-being all together we can call as healthy condition, or we are healthy. So anything is getting disturbed, we can say that that is going to be an unhealthy situation or unhealthy condition, right? So we defined health in physical, mental and social well-being, right? So here next we are going to learn about disease. How we can define the same way what is disease? What do you mean by disease? See, the disease, this word itself gives us a lot of or a vast explanation of a very clear explanation about the condition. What is that? We can think disease as disturbed ears, disturbed ears. That's easy condition that is getting disturbed. Okay, so the normal condition or the easiness of our life that is getting disturbed. Like we can say, we are not comfortable in that condition. That is some uncomfortable situation. Uncomfortable situation, whether it is mentally or physically or socially, whatever may be, we are not comfortable. So that situation is called as, or that uncomfortable situation that is called as disease, or that is a disturbed situation from the normal or peaceful situation. That is somewhat we are getting disturbed, our body is getting disturbed, our mental health is getting disturbed. So that is called as, that disturbed condition is called as disease. Okay, so the word which one we are using, this disease, that is used more limited meaning, that is used in a more limited meaning. So we can talk about disease when we can find a particular cause of that discomfort. Okay, see, this doesn't have a meaning that we know the final cause or final reason for that. We can say someone is suffering from some kind of diseases, like we can say fever or something, without knowing exactly what is the reason for that. We can tell several reasons, right? So one by one we can find out and come. So if you're going to a doctor, like I'm saying my body is paining, I have severe body pain, I have severe headache. So first they will ask like the general reasons, right? So from step, they will also take action step by step. See, if I'm going and telling like I'm not feeling well, I'm saying I'm not feeling well, and I'm saying like a particular reason, headache. Any doctor will suggest like, okay, now itself you need to do a surgery. No, we'll open your head or open your brain part, we'll check what is happening there. Any doctor will suggest like that? No, first they will ask the general reasons, whether you have any tensions, like whether you have any other issues, like you didn't sleep well or anything like that. That's a common, just common issues. Maybe mentally we'll be disturbed with something, so we could not sleep properly. That may be the reason. If you're not sleeping well, your brain is getting extra tasks, right? So that may show, our body will show that as a headache, right? It may go to fever. And in our body, some microorganisms are entering. First our body will increase the temperature, right? See, our body itself is taking preventions, or to avoid that condition. It should not go, that organism should not multiply. For that, what first our body will do, our body is trying to increase the temperature, our body is fighting with that organism, that microorganism, and it is increasing the temperature, so that it is trying to stop the activity of that organism. That's how we are feeling a fever, right? So actually we'll say fever is not a disease, or it is not a health issue. Our body is fighting against something. So that is coming as a fever. So first itself, when we are getting a simple fever, we should not take medicine. Usually people will say, doctor will say, we should not take medicine. We should not take antibiotic at a stretch. Until and unless you are making sure that this is a particular type of fever, they will not suggest you any medicine. What is the reason behind that? Because our body is fighting against something. That may be like some other issues, like if your body is not getting proper rest, your body will show that, because there is a limit for everything. Even our body can withstand up to a limit, right? Continuously it can't work, that need rest, otherwise it will express as some kind of uncomfortable situations. Through that it will express. You will feel body pain, headache, you will feel sleepy, you'll feel so tired, right? So that's how our body is reacting to a uncomfortable situation. So we can say like someone is suffering from some disease and they don't know exactly whatever the reason is. Okay, so in that condition, what we can say, it doesn't have a meaning that we don't know the final cause, so we can't find out that what is happening there. So that is, so such kind of simple discomfort will be there because our body can express. See, our body can't say that, see, I'm feeling like this, so you have to treat me in this way, you have to give me some rest. So to show that if we are not feeling well, our body will express as some body pain, fever, headache, something, right? So that shows the symptoms, like some kind of problem or some discomfortable situation is there. So you need to take rest according to that. Okay. So we cannot easily see that is possible to be in a poor health without actually suffering from a particular disease. See, we can easily find out, sorry, what I want to say is we can easily find out. Okay, there is no necessity to suffer from a particular disease. So if we are in a poor health condition, we can easily find out. Slowly, first our body will show simple symptoms. Symptoms will be there, right? Then also we are not treating, or we are not taking care. Then it will go to the next stage. It will become little more severe. Then again, that also you are not taking proper care. It will go to next stage. So that's why for every uncomfortable situation, our body will show symptoms, isn't it? Our body definitely, if something is entering to our body will show some kind of allergies, which is not suitable for our body. Definitely, body will show some allergic conditions, like sometimes rashes may appear. So that is a symptom. So you should give treatment for that. You should go to doctor, you should consult doctor, or you should take actions for that. You're thinking like, okay, let it be. After 2-3 days, it will go. Then what will happen? It will move to the next stage. Suppose if you are showing that in the first stage itself, it will not go to the severe stages, isn't it? So whenever you are feeling that you are uncomfortable, you are not feeling well, that is the time to take rest and to take necessary actions according to the situation. So now we can easily see that it is possible to be in a poor health without actually suffering from a particular disease. Sometimes our body won't show much symptoms. Okay. Then also sometimes poor health condition may appear. Okay, so good health, according to our profession, good health is important. See, now I'm taking classes. If I'm having some throat issues, that will affect my life, right? So if for a singer, think about that. If they have any breathing issue, or if they have any lung infection or something, that will affect them in a very bad way, right? So it depends. So we need to utilize our potentials in a real way, in a necessary way, or in a proper way. We need a good health, right? See, a politician, they need to address many people. In one day itself, they'll be traveling here and there. If their health is not good, what they will do? So first of all, first and foremost thing in our life, that is maintaining a good health. Okay. So we can be poor in our health. Okay. So sometimes there won't be a simple cause in the form of any identifiable diseases. So that is the reason why when we think about health, we think about societies and communities. Okay, and sometimes not about the community, some individual sufferers will be there. So that everywhere, health is very important. We should keep in mind that everywhere health is important. Sometimes you won't be having, see, some people, they will be having physically very good appearance, and they've never felt, up to that moment they might not have felt any discomfort. So whatever may be, sometimes some simple blood test, maybe for blood donation they might have gone. While testing blood, they will come to know that they have some severe diseases. Such cases are also there, right? So diseases in any stage, that we need to identify, we need to take actions for that, according to which stage we are in. There is no matter whatever it is, there is no need to run away from that. Don't think like that it is going to kill you. So just take actions according to the situations, according to the health conditions. And now we are going to discuss about disease or diseases and the causes of disease. Disease and its causes. So in that first, we'll discuss about what does disease look like. See, first of all, how we'll come to know that we have a disease, or how we'll feel like something is going wrong in our body. See, there are many causes, or there are many tissues. We have learned about tissues, right? So we have learned how the tissues, how the cells in our body will be, how the tissues will be, and how these are working. So these tissues, we know that tissues, different types of tissues are there in our body. So this makes, or different types of cells are there. The cells are making tissues. Say a group of cells which are having the same work, they will make the tissues, and they'll make the organs, then the organ system, right? So like that division of labor, you can see. According to the division of labor, different types of organs, organ system, tissues, everything is there. So that is making up the physiological system, or the organ system, which our body functions. Right. So each of the organ system, that is having a specific organ and different parts. See, organ system that is having a specific organ which is carrying out the function, and different parts of that organ you can see, right? See, if we are thinking about heart, it is having different parts. It is having 4 different chambers, and each chamber is having its own function. Some part is collecting pure blood, some part is collecting impure blood, and another part is uh, giving, or it is sending pure blood to different parts. So like that, each and every organ and the parts of that organ that is having specific functions. So it is having particular function. So here we are saying about the digestive system. Digestive system. So here the digestive system that is having stomach, then intestine, and for what all these things are doing, what this stomach and intestine they are doing, they are helping to digest food which is taken from outside the body, right? So taking place, that is through mouth. From mouth it is passing through all the portions, it is reaching in the stomach, and there digestion is taking place. So the stomach or intestine, whatever may be, that is helping for digestion, isn't it? So that is helping for digestion, and the food which is taken from outside the body is getting digested. Then our muscular system and the skeletal system, that is muscular system plus skeletal system. So the muscular system and skeletal system, that is made up of bones and muscles. Okay, this is made up of bones plus muscles. Which one? Muscular system and skeletal system is made up of bones and muscles. So this muscular system, can you imagine without muscles how we will make movements? Without skeletal system, whether your body will be having any shape? No, these muscles are connected here and there with the help of that skeletal system, or that skeletal system that is giving a framework. On that, this muscular system is working. So both are working together, and that is making our movement. These bones and muscles are working together, and that is helping us to move. So that is making the movement, right? So just any problems or any disturbed condition for all these things that will affect our body, right? So when there is a disease, either the functioning of one or more system of the body will change, isn't it? If there is a disease, one or more than one system will get affected, right? So their condition will go worse. So these changes will give rise to symptoms and signs of disease. Right. So that's how we'll come to know that we have some disease or our health is getting disturbed. Right. See, one person is not feeling well, he's having some heart issue. While walking, he'll feel some kind of discomfort. Means muscular movement that need more energy. So, and more blood circulation if daily he is going for walking. Okay. And he doesn't know that he is having heart related issues. Okay. So one day he is walking in a faster way, morning exercise, they'll be doing regular exercise. So if he is doing regular exercise, in between he's finding that he is not comfortable with the exercise. When he is increasing speed, sweating started, then or it is something like that, some kind of discomfortable movements are happening in the body. So see, if you're walking, when we are doing exercise, we need more blood circulation in our body. So if your heart is not feeling good, or it is having some discomfort or some diseased condition, what will happen? It will not be able to pump the blood. right? If there is any block, the space is getting reduced for pumping the blood, right? The movement of the blood is, it is getting blocked. So when the heart, because our body, if you are running or if you are walking in a faster way, blood circulation should be more, otherwise you will become tired, right? But if there is a block in your blood, see, this is your heart. So here, while pumping here, so many blood vessels are there. You think here one block is there. It's not a complete block. Some 90% block is there. See, this is your blood vessel, and here 90% is blocked. Only this much space is there to pass the blood. But your heart is pumping in the same way, the same percentage or the same pressure it is giving, and the blood is coming up to here. But through this way, it is difficult to pass the same volume of blood, right? So there you will feel a pain or you will feel some kind of discomfort. If blood is not reaching in the cells or in the muscles, your muscles will become tired because that need oxygen, energy, everything which is passing through the blood. So you will find a discomfort, right? So that situation which is affecting the body and body organs, that is a diseased condition, right? This and all somewhat higher diseases. Just take the example of a simple diarrhea. You'll be continuously going, like you'll be like 2 3 times from the normal way. If you're going morning one time to washroom, instead of that you will be going 3 4 times. Whenever one food item is reaching your stomach, you will feel somewhat discomfortable, you will go to washroom, so that you are getting dehydrated. So if you are getting dehydrated, can you imagine, you cannot walk even 10 steps, and you cannot even stand there, right? Because your body will become totally tired. So that kind of situations where there is a disease, either the functioning of one or more system of our body will change in a worst way, right? So these changes, so those changes, that is giving the symptoms and the signs of disease. That shows the symptoms, right? And that you'll become tired. So that tiredness shows that is a symptom, and that is the sign of disease, right? So you have some kind of problem, health issue, that shows the sign of that disease. So symptoms of disease, they are the things which we are feeling like something is wrong, right? So if you have a headache, we have cough, or we have loose motion, like that, or we have wound which is with pus, these all are the symptoms, right? So all these are indicating that there may be a disease, may be a disease. Okay, but they are not indicating that what is that disease exactly. These are the symptoms we can tell. See, if you have fever, you will get headache, you will get vomiting sensation, you will become tired. So all these are the symptoms, right? It doesn't have a meaning that which disease exactly you have, or it will not give a clear idea. By noticing the symptoms, you can make a conclusion. This may be this, either disease A or disease B. Then you have to concentrate on disease A. If that is also not clear, you should go to the next stage, disease B. So like that, step by step, you need to identify. So that indicates that there may be a disease, but they don't indicate what disease exactly it is. See, for example, a headache may be just examination stress, right? See, continuously morning onwards, you are listening to different classes, like one hour physics, 1 hour chemistry, 1 hour biology, 1 hour maths. So continuously, that day you are not feeling well. You have some kind of tension, or the previous day you didn't sleep well. You could not sleep. due to some exam or something, and next day continuously you're coming and hearing all these lectures. So very rarely, like it may be because of that stress, or rarely there is a chance like it may go to some other disease condition. Like that may be generally what we'll say, okay, previous day you couldn't sleep well, that may be due to that, take rest. That's a general suggestion. But sometimes, rarely, that may go to the other cases also, like some other issues, like some other health problems will be there which shows the same symptoms like headache. So that sometimes there is a very less percentage that any other different diseases which is showing the same symptoms. So signs of disease, we can say signs of disease or symptoms of this disease, they are the things what physicians will look for the basis of the symptoms, right? They will consider that as the basis of the symptoms, and those signs they will consider, and according to that they will give some suggestions, right? So signs will give a little more definite indications of the presence of a particular disease. See, some kind of rashes are coming, that shows you have a particular viral disease or something, right? See, if you have chickenpox, definitely the that chickenpox virus, that will show some symptoms, like on body you will get rashes. By seeing that, a physician can make out this is chickenpox, nothing else, right? But sometimes the same symptom will come for several diseases. Okay, so signs, the presence of a particular disease that shows or that is indicated by particular signs or symptoms. So physicians will also get some, they will ask you to do some lab test, laboratory test, okay, to confirm the disease. Clear? So this is how a disease look like. So diseases look like this, like they will show severe symptoms, they will show severe, sometimes the symptoms may be very severe, sometimes it will be light. So according to that, you need to take the suggestion of a physician and you need to take further steps. Okay, so that's what, from the normal condition, your body is showing some disturbed situations, or your body is facing some disturbed situations, and according to the disturbance, the percentage of disturbance, it will show some symptoms or indications which we need to consider as the symptoms or signs of that disease. Okay, so according to that signs and the severity of that infection or whatever may be that disturbed condition of your body will react, or your body is responding. That response is coming as the symptoms or signs of that disease. Clear? Then diseases we said. So now you came to know that this is a diseased condition and how our body will respond to that, right? So there, this diseases, we can say acute and chronic diseases. Acute and chronic diseases. So the manifestations of disease, that will be different depending upon the number of factors. Okay, some diseases that will last for only very short period of time. Some diseases that will be for a short period. Okay, and such type of diseases which are lasting for very short period, they are called as acute diseases. Okay, some diseases which are lasting for only very short period, they are called as acute diseases, like we know, like common cold. that will last for few days, right? And some other diseases, but some diseases that may last for lifetime or for a long time. For a long time it may last, sometimes it may be lifetime. So such diseases, they are called as chronic diseases. Okay, so there are two types of diseases. It is according to the period. If it is lasting for short period, we can call as acute disease, and if it is lasting for long time or sometimes maybe lifetime, we can call as chronic disease. Okay, so like, hope you have heard about elephantiasis. Elephantiasis, which is a very common disease in several parts of India. Still, it's there in India. So that is very common in some parts of India. Okay, so this elephantiasis, that is example that will be there for lifetime. Okay, it won't go for after a short period, it won't go. So lifetime we have to be with that disease. Okay, so some diseases that will last for short period, that is called as acute disease, and some diseases last for long time or sometimes whole life we need to bear that disease. Such diseases are called as chronic diseases, and elephantiasis is an example. And for acute disease we can say common cold or common fever, that is an example for acute disease, which is lasting only for few days or for a short period. Okay, then let's see the chronic diseases and poor health, the relation between chronic diseases and poor health. Okay, see this acute disease and chronic disease. We have learned about what is acute disease and chronic disease. This acute disease and chronic disease both have different effects. Both have different effects on our body. Okay, or it is affecting in a different way. Okay, our health is affected by both the disease in different ways. See, any disease which is causing poor functioning of some part of the body will affect our health. Any disease. Okay, this is because all the functions of our body that are necessary for us to be healthy, right? So see, after some disease, some part of our body will get affected. Not all the parts, some parts will get affected. So that is because, see, if any one part is getting affected, that will affect the body, because all the parts should work in a healthy way. That gives a healthy condition, right? So because all the functions of our body are necessary for being a healthy person, or to be in a healthy condition, all the parts should work in proper way, right? See, any disease which is causing the poor functioning of some parts, that also will affect the health of our body, right? But here, an acute disease, Acute disease, which is lasting for short period, right? That is getting over very soon. Acute disease that lasts only for short period. So that doesn't have time to cause major effects on our body or on our general health. Okay. But a chronic disease, in the case of a chronic disease, it lasts for long time. And that may cause, or that is getting more time to cause several health issues. That may cause several severe health issues. Okay, there's a chance. Okay, so an acute disease which is over very soon, that will not have time to cause major effects on general health, while a chronic disease will do severe health issues. See, just for an example, we can think about cough and cold. All of us might have gone through that time to time, maybe due to climatic issues and all, that may come and it will go. So most of us will get better and will become well within a week, right? Common cold or cough, common cough or cold. So that may be for a week or maximum for 10 days, right? After that will become okay. Right? But if we have a chronic infection or a disease, we are getting infected with chronic disease like tuberculosis. Just think about tuberculosis. What will happen? Then it will be there for years. Okay, that is a chronic disease which will last for years, and that will infect our lungs, and there will be this disease will be there for years, which is making us to lose weight and we'll feel tired all the time. Weight loss will be there and we'll feel tired. So this is for years. That is the difference between a acute disease and a chronic disease. Okay, and all the time we'll be feeling tired. So we may not go to school for few days if you have a acute disease. If we are getting a fever, you may take 2-3 days leave, isn't it? But a chronic disease that will make our life difficult. Okay, so if we have a severe or a chronic disease, whatever they are teaching in school will reduce our ability to learn, right? Because our health is going worse means we cannot concentrate, right? If you're always feeling tired, you think about how, just imagine how can you sit in the class? It's impossible. And maybe for 1 or 2 hours you can sit without any problem. Afterwards, your body will become weak, you will become tired, you cannot concentrate in class, you cannot sit there, you cannot play with your friends. So several issues will come. So in other words, we can say we are likely to have prolonged general poor health if we have a chronic disease. Okay, so general poor health situation will last for a long time if we have a chronic disease. Okay, so chronic disease, therefore we can say they are very drastic and long-term effects that will create on our health compared to acute disease. Okay, see, acute disease, if you are not feeling well, we have a fever, just 1 week, if you are taking medicines or sometimes without medicine, it will go. And afterwards, if you are eating healthy food like fruits, vegetables and all, if you are eating well, you can recover. Your health will be same as like the earlier time, right? Your tiredness will go, everything will go, you will become very cool after some time, right? After a few days you will become okay. But when you're getting a chronic disease, it's a long time. That poor health condition will be there, which you suffered just for 1 week. When you have an acute disease, the tiredness and the poor health condition, whichever was there in your body, such poor health condition will be there for long time when you're getting a chronic disease. You just imagine a whole Just if you are getting for 6 to 7 years, if you are getting every day, you are becoming tired, you are not feeling well, you are not able to play, you are not able to sit, you are not able to eat well. Think about that. You will lose, first of all, you lose your weight, right? And you will not be able to concentrate in anything, because always you are feeling tired, you are feeling like sleeping, or you are feeling sleepy. What will be the situation? So that will last for several days or several years. So your total health condition is getting disturbed. So that is affecting your mental health. So in a chronic disease condition, the whole system is getting, our whole body or our whole life is getting affected. So compared to acute disease, chronic disease is giving drastic long-term effects on people's mental as well as physical health. Okay, so that's the effect of a chronic disease and poor health condition you're getting after a chronic disease. Okay, so in today's class we have learned about acute disease and chronic disease, and what is a disease condition, what is the causes of that, and how a disease condition looks like, that you have learned. Then chronic disease, if you are getting infected with a chronic disease, what will be your condition, and what is the difference if you are getting infected with the acute disease and chronic disease, that we have learned. In the next class we will be learning about causes of this disease. Okay, thank you.
This conference will now be recorded.